Hello, my name is Vivi Ruiz. I'm a nurse practitioner student, and I'm going to be doing a neurological assessment on my mother, Norma. First, we'll start with cranial nerves. So cranial nerve number 1 is the olfactory. So I'm going to have my mother smell something. Close your eyes, Mom. What do you smell?
Alcohol.
Alcohol. So I have sanitizer there, so that's what she smells, the alcohol. Usually people can use like coffee beans or orange scents, anything like that. My second cranial nerve that I will be assessing is the optic and the oculomotor, which is cranial nerve number 2 and 3. So what I would do is I would have the ophthalmoscope and use the light, but I don't have one, so I would just pretend. So I would look first into my mother's eyes, and I would zoom in like this, and I would look behind the pupil for the optic nerves. And then with the light, I would check for perla, make sure that her pupils are equal, round, and reactive to light with the light in and on. The third optic cranial nerve, the third cranial nerve is the oculomotor, and that's, like I said, like with the light. The 4 is the trochlear, and I'm gonna have her follow my fingers. So follow my finger with your eyes. Don't move your head, just your eyes. Can you see my finger?
Yes.
Follow my finger. Okay. And so I'm just making sure that her eyes are following and there's no nystagmus, like movement of the eye. The 5th cranial nerve is the trigeminal, which is a sensory cranial nerve. And so I'm gonna have my mom, I'm gonna touch her jaw, and I'm gonna have her clench. So go like this, and then move side to side. Good. And that looks great. So it's good. So besides that, then I'm gonna use a little instrument. Close your eyes for me, please. And I wanna ask her if what she feels is soft or dull or sharp. Is it soft?
Dull.
Okay. Is it sharp?
Sharp.
Okay. And you do it on the other side as well. Okay. I'd like to mention that when I did her, when she followed my fingers, that was the cranial nerve number 6, which is the abducens. So I did that already. The next cranial nerve that I will be using is cranial nerve number 7, which is the facial one. So I'm going to ask my mother to do a couple things for me. Can you smile? Good. Can you frown? Can you puff up your cheeks? Like, good. That looks intact. My next cranial nerve is the acoustic, and it's to test her hearing. And I already know she has some hearing loss, so she might not be able to pass this test, but I'm just gonna go ahead and try the whisper test. I'm gonna cover your ear and tell me what you hear, okay? Apple. What did you hear?
No here.
I know.
Door. A little bit.
What did you hear?
A little bit.
What did I say?
Towel. Towel.
Towel? Nope, that's okay. All right, so I said apple and door.
Okay.
But that's okay because I know she has some hearing loss. My next cranial nerve is it's the same one. So I would have to do the Weber's test and the Ringer's test. So I don't have the equipment. So to do the Weber's test, I would slap it and place it on the top of her head or the top of the forehead. And I would ask her if she's able to hear the ringing on both ears. And if she's able, then it's great. If it's not, then there's some deficit. And then for the second test, I would place it behind her mastoid bone, and I would ask to see if she can hear it, and when she cannot hear it anymore, to tell me. And then I would pull it out and see if she can still hear it or not. So that's what I would do. So the next cranial nerve is cranial nerve number 9, the glossopharyngeal, and 10, the vagus nerve. And so, Mom, I'm gonna have you swallow for me. And usually people with CVAs like aren't able to have like a good swallowing reflex, so she's able to swallow. And then part of the assessment includes assessing the mouth and the palate movement, tongue, uvula that's intact. So open your mouth for me. I don't have a tongue depressor, so I would pretend. You open, have a light, you can see the uvula that's in the middle. You can lift the tongue up and see like how things move inside the mouth, and that's all intact. The last nerve is cranial nerve number penultimate. It's not the last one. Number 11. It's the spinal sensory one. So what I'm gonna do is I'm gonna put my hands on your shoulder, and I need you to shrug for me. Okay, good. And that's just testing to see if she's able to move her shoulders up and down against resistance. Can you do it again? Good. Now I'm gonna put my hand on her chin, and I need you to turn your chin that way. Good. And then this way. Good. And that's intact. My last is the hypoglossal, which is the cranial nerve number 12. And I'm gonna have you stick your tongue out. Say ah. Okay, good. And that's just checking that the tongue is midline and not deviating to the right or to the left. Usually patients with CVAs, their tongue will deviate to the area of infarct or where there was the wound. So, and that concludes my the second part of my neuro assessment is the cerebellum test. So with the cerebellum test, I'm testing for speech and resistance and eye movement, to mention a few. So obviously when I'm doing an assessment with a patient, I'm communicating from the beginning so I can assess how their speech is. So I'm just gonna ask my mom to say a few words. Say, I love my daughter.
I love my daughter.
Intact. The next one is I'm gonna ask you to follow my finger. Do not move your head, okay? Follow it with your eyes. Good, and I see that both eyes are moving at the same time and there isn't any nystagmus happening, so I'm gonna do it on the other side too. So every time we do an assessment on one side, we have to repeat it on the other side because we wanna make sure they're both intact. Now I'm gonna go ahead and check your shoulders. So I'm gonna place my hand on your shoulder and I need you to shrug. Good. All right, now bring your arms out. Relax your hands, just bring it over like this. Push up for me, please, up. Good, don't let me pull down. Push down, good. Push out, good. And then push in, good. Now I'm gonna ask you to kick me with one leg. Kick, kick, patea, patea. Okay, and then this one, okay. Ahora, el pie hacia ti, towards you, and then this one towards you. Okay, good. Now I'm gonna ask you to bring your knee up. Okay, good. And now this one. Good. Now bring your knees out. Good. And now bring your knees in. So now I'm gonna test the rapid alternating movements. So mom, put your hand out like this. And then with one hand, go like this. Faster. Nope. Okay, so with this, with the other hand, go like this. And then the other one again. Okay. Thank you very much. Now I'm gonna test some reflexes. So I don't have a hammer, so I'll use the end of my stethoscope. So relax your leg, normal. So we'll check for reflexes. There you go. Good. Can you remove your sweater for me, please? So I'm gonna remove your watch here. And I'm gonna check her reflexes here. And you can see her arm jerking a little bit there. There. Relax your hand. There you go. Okay. So that's that. So now I'm gonna check my mother's gait and balance. So can you walk forward, please? Good. Now walk back. Good. Now turn around and bring your arms out like this and close your eyes. Okay, good. You can open your eyes. Good. Bring your arms down and walk on your heels. Good. Walk on your tippy toes. Good. All right. Let's go back into the exam room. Forgot to test one thing, which is the pronation against resistance. So, Mom, bring your arms out like this. And I'm gonna push down. Don't let me push down, okay? Ready? And that's positive. So you want it to go back up. So now we can return to the exam room. All right, so now I'm going to check for stereognosis, which is I place an item into my mother's hand and she has to tell me what it is. Close your eyes. I'm gonna give you something and I need you to tell me what it is. What is it?
Money.
What kind of money?
25 cents. Dollars.
Is it a bill or is it a coin?
Coin.
Okay, you can touch it with the other hand. You can touch it with your other hand too, like. So it's a coin?
Coin.
Okay, good. So that's good. The next one, it's called graphesthesia, and so I'm gonna write something on the palm of her hand and she needs to tell me what it is. Close your eyes. What am I writing?
The letters.
Okay, what is it?
M.
M? Okay.
B.
I'm gonna do it again, okay?
Again. J. No.
What is it?
J.
What?
J.
J? No. So I did a number 8 and I did number 3, not an M, but I can see how she would confuse it with an M. So, and then the other exam that I'm gonna do, it's called the 2-point test. So I am gonna go ahead and close your eyes, ma'am. Grab a bobby pin. Tell me, do you feel this?
Yeah.
This?
Yeah.
This?
Yeah.
This?
Yeah.
So I did it with 1 point of the bobby pin. Now I'm gonna spread the bobby pin a little bit apart and touch it with 2 and see if she can feel it. Sometimes patients are not able to feel the 2 points because they're too close together. So I have to make it as separate as possible so she can actually feel 2. So let's see what she feels. Do you feel 1 point or 2 points?
1 point.
And that's okay. Again?
2 points. 1 point. 1 point.
Okay, so now the last part of the exam includes me touching you and you telling me if you feel me touch you or not. Okay, so close your eyes. Can you feel me touch you?
Yeah. Yes. 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 Yes.
Okay, so it's not my last one. I have to do one more. So I'm gonna have you lay down. Pause it. So when she's laying down, I'm gonna check abdominal reflexes, but I'm not gonna lift her skirt or cover her or show her abdomen for this video. But what I would do is I would uncover her abdomen and I would touch with an object, like my sharp object, and go like this. And then you can see the abdomen kind of retract a bit, and the same on this side. If someone has a lot of adipose tissue, like I wouldn't be able to see that. My next test, it's going to be the Babinski test, and excuse my mother's feet. So with this test, I'm gonna check her reflexes and I'm gonna come from here to here. and I can see how her feet react. Her feet doesn't bend how it's supposed to bend. She just jerks her leg, but you can see it coming like this. And then coming like this. But there is a reflex. And that concludes my assessment.